Public Health England has just launched the latest edition of Health Matters, which focuses on making cervical screening more accessible. Cervical screening is not a test for symptoms of cervical cancer. Screening is intended to detect abnormalities within the cervix that could, if undetected and untreated, develop into cervical cancer. Although cervical cancer mortality rates have decreased by up to 70% since the introduction of the NHS cervical screening programme in 1988, there were still 726 deaths from cervical cancer in England in 2014 and a total of 890 in the whole of the UK. Despite the success of the programme, screening coverage has fallen over the last 10 years and attendance in England is now at a 19-year low. Attendance is going down across all age groups. Coverage amongst women aged 25 to 49 was 70% at the 31st of March 2016. This compares to 74% at the end of March 2011. For women aged 50 to 64, the coverage at 31st of March 2016 was 78%, which compares to 80% at the end of March 2011. Declining uptake of cervical screening has serious implications for cervical cancer diagnosis rates and mortality, and financial implications for the NHS and the wider economy. Health professionals, most typically GPs, should be alert to the symptoms of cervical cancer and should refer women for further investigation where necessary. Anyone who presents to their GP with symptoms of cervical cancer should not be told to wait until they are next eligible for screening. Not going for cervical screening is one of the biggest risk factors for developing cervical cancer. Many women do not attend for screening because they're embarrassed about having a smear test, they're concerned about the result of the test or about the procedure. Access to screening can be difficult, appointment times may be inconvenient and fall within working hours. Women may have a low perceived risk of cervical cancer, or they may simply be unaware of screening. Several studies have identified groups that are frequent non-attenders for screening: younger women, women over 50, women from ethnic minority groups, also lower socioeconomic groups, women with learning disabilities and lesbian and bisexual women. This edition of Health Matters focuses specifically on what can be done by public health professionals, the NHS and local authorities to help increase awareness of cervical cancer, to overcome the barriers to cervical screening and to improve its coverage. This can only be accomplished through a collaborative approach with effective partnerships and coordinated action at a local level across the public, private and voluntary sectors, with all organisations across the system taking this forward to improve the quality of the cervical screening services provided and address the inequalities. Please take a look at the Health Matters online resource. It includes recommendations and supporting materials, including downloadable infographics and slides that you can use in presentation and discussion with colleagues. It also has case studies and videos. Thank you for watching.